Smith. My name is Tiffany, and I am one of the student nurses here that is going to be working with you today. I just want to check, it looks like we have a need for some Zofran medication that will help with your nausea. Is that correct? And she says yes, she has been feeling nauseated. Okay, so we have that ordered for you, so I can go ahead and give that to you through your PICC line that you are using currently for your long-term antibiotic use. So we will be able to just go ahead and administer it in that same PICC line. Do you have any allergies that you know of right off the bat? She says she's allergic to morphine. Okay, that's good to know. We're not too concerned about that. Can you go ahead and tell me your name and date of birth, please? And so she tells me her name and date of birth. Okay, perfect. I'm going to go get my equipment ready and all my supplies so we can go ahead and get that medication to you. So I would go ahead and check here. I see Mary Smith here on my MAR. She's allergic to morphine, which is correct. And we have an order for 4 milligrams of IV push Zofran or ondansetron every 4 hours PRN for nausea, where she has nausea and she has not received the medication in the last 4 hours, so we're okay to give that medication. I'm going to go ahead and do my math here. I do have Zofran present, 5 milligrams per 2 mils. Expiration is 12 of 2030, so it is all within expiration. It looks clear, no concerns there, and I'll go ahead and do my math. So my order here is for 4 milligrams, and I have, again here, 5 milligrams per 2 milliliters. And so I'll go ahead and do my math quickly. So 4 times 2 equals 8 divided by 5. 1.6. I'm giving Mary Smith. So I will look at Zofran quickly. I do not have any concerns about a compatibility at this time since we are not infusing anything right now. I do not need to dilute this medication, and I need to give it over 2 to 5 minutes preferred. Here I see. Okay, so I know I need 1.6 milliliters. I'll go ahead and get this ready. So I'm going to get any air bubbles out. I'm going to leave my cap here. And I'll go ahead and wait until I have my... Okay. All right. I'm going to go ahead and put my cap back on really quickly though, maintaining sterility. And you can see, just want to make sure. All right.
I'm sorry, I need to tilt it a little bit.
Okay, so you see I have 1.6 milliliters present here. The plunger is right beneath that 1.6 milliliter line, and I do not have any bubbles present in the syringe. So that's ready to go. I have my flushes for when I go ahead and deliver the medication. So at this time, I'm going to go ahead and do my 5 rights. So I have Mary Smith, allergic to morphine. She's getting ondansetron, 4 milligrams, IV push every 4 hours PRN. She's not had it within the last 4 hours. My math is 1.6. I have 1.6 milliliters here of my Zofran. Expiration is 12:30. And then I'll go ahead and do that 3 times. So Mary Smith, we check with the armband Mary Smith. She has on Dancitron, 4 milligrams IV every 4 hours PRN. For nausea, she has not had that. She's not had Zofran within the last 4 hours, and the 4 milligrams would be 1.6 milliliters, and I have 1.6 milliliters of Zofran in the 5 milligram per 2 milliliter concentration. And then again, Mary Smith, she has Zofran ordered on Dancitron here, 4 milligrams IV push every 4 hours PRN. She has not had that within the last 4 hours. I have Zofran here, 5 milligrams per 2 milliliter concentration, and I calculated out to be 1.6 milliliters, and I have 1.6 milliliters here. So I've done my my 5 rights 3 times, and now I can go ahead and get ready to administer the medication. So I'll wash my hands, and then I'm going to go ahead and bring my equipment over to the bedside. Make sure we are within a comfortable working position. Alright, and I don't see any issues with the site. It looks intact. I don't see any concerns, redness, edema, or anything like that. Any signs of infection at the site. So okay, so put my gloves on. Alright, so I'll go ahead and clean. I will be using the distal port here for the medication administration that I'll be using. I do not see that this has a clamp on it. However, we would clamp that. These would be clamped if they're not in use. So I'm going to go ahead and clean per agency policy the port here for 30 seconds. Done so, and with that I can go ahead and get my normal saline ready. It's with an expiration date. No concerns there. Relieve any of the air bubbles there. And I would go ahead and flush. With 5 milliliters. Alright. And then I'll go ahead and clean per agency policy. Clamping in between when I don't have anything actually attached to it. And then I can go ahead and give my medication really quick. Zofran, 1.6 milliliters. Alright. And I can go ahead and attach this. And again, I want to deliver this over 2 to 5 minutes. And so I'll go ahead and administer that. So for time's sake, I would use a clock or look at the clock to make sure that I am delivering it over the appropriate rate. Again, there's no dilution need here. So I'd go ahead and administer this over 2 to 5 minutes. And then I would, for time's sake, I'm just going to time lapse here. And I'd administer my medication, take that off, and then I would go ahead and clean the site. Oops. Clean the site again, per agency policy. 30 seconds. And then I would go ahead and make sure again that this is within expiration date. I would release any of the air and attach. Making sure I would unclip here when I'm attached and ready to be using it. And then I would flush. So I would flush this at the same rate as I would the Zofran. And so I'll flush this in about 5 milliliters, and then after that, with this being a PICC line, we do the pulsating flush. So I would, for the remainder, I can do pulsating flush, which creates some turbulence. Okay, and so I would reassess Mary, and I would see if she's having any reactions. I don't see anything at the site. She doesn't have any pains, not complaining of anything. I want to make sure she's in a nice, comfortable position with where her head is elevated, the bed is in a low position, and that she's comfortable. She has a call light within reach. Her site is now still secure and appears to be fine. So after I've administered my meds, I want to go ahead and take my supplies and get rid of those in the appropriate receptacle. And then I can take my gloves off. I will wash my hands. With this being Zofran, I don't have a lot of concerns. You know, a lot of it is on the rate of administration too. So if she were elderly, or I don't really have a lot of concerns with the elderly versus them being a younger patient based on, so the only thing that may be there is if I need to administer at a slower rate, if they maybe never had this medication before, kind of looking at signs and symptoms after receiving the medication. So I just want to make sure I'm appropriately treating my patient based off of their age group. And I cleanse my hands there, and then I'll go ahead and document. I want to document the medication, how much I gave, any reactions, no adverse reactions were present, so I want to document how the patient handled that, you know, essentially documenting my 5 rights and the patient's response to that medication. And go ahead and wash my hands and exit the room.